Welcome, everyone. We'll give people just a couple minutes to join. I see we're already at 100. I think we had about 160 people on the registration. So I want to make sure everybody gets in before we get started. Thank you. All right, for the sake of time, and this is being recorded, welcome everyone. We're going to go ahead and get started. I know people are trickling in, but again, this session is recorded. I think it would have reminded you as soon as you logged in. My name is Lindsay Cotto. I am the Division Director for the Division of Public Health, and I want to welcome all of you to Transforming Emergency Medical Services in Alaska. So this is funding opportunities through the Rural Health Transformation Program specific to um, emergency medical services. So thank you so much for joining. Um, some of you may have attended previous sessions, but again, this is a really special session on advancing EMS from point of crisis to point of restoration. And we've got some incredible panelists today. This is our agenda. We'll just do a brief welcome. Heidi Hedberg will give an overview of the Rural Health Transformation Project, the future of EMS in Alaska, EMS priorities, application guidance, and then we'll take questions in the question and answer panel. I'll be your facilitator for today. I'm looking forward to listening to you all and seeing what questions you come up with, and of course, getting more familiar as we go along with rural health transformation. Our speakers today are Commissioner Heidi Hedberg, who has been leading much of this effort with our Rural Health Transformation team, Dr. Bob Lawrence, our Chief Medical Officer for the Department of Health, Tracy Loskar, the Deputy Director of the Matanuska-Sistina Borough EMS, and Tricia Franklin, Acting Section Chief for Rural and Community Health Services or Health Systems. But also just want to put a note in there that Tricia has decided to leave the Division of Public Health because this is such an incredible opportunity. And she is going to go work at the state office of as the Rural Health Director. So thank you, Tricia. We'll miss you, but excited to see you're the perfect person to help everybody on their journey. So with that, I want to turn it over to Commissioner Hedberg and let her talk a little bit about rural health transformation.
Good to see so many of you show interest in the EMS focus for the Rural Health Transformation Fund. So what I would thought we would do is
Can everybody hear me? Is it just might have to talk a little bit louder?
Can you guys hear me? Can you guys hear me?
It's very soft.
Oh no.
Oh, there you are.
Mm-hmm.
I don't know what you did, but you're there now.
Okay. All right. As I was saying, it is so good to see so many of you. Again, today's focus is on EMS and the Rural Health Transformation Program. So let's ground ourselves in the basics, and then we'll dive into more of the meatier topic areas. July 4th is when Congress created the Rural Health Transformation Program. It is a 5-year federal cooperative agreement. It is $50 billion, so $10 billion per year. And it really is intended to transform rural health, how Alaskans access and use healthcare. It is to shift from our fractured, really focused on acute care settings into that prevention model, and to ensure that Alaskans have access to the care they need at the right time with the right resources. We immediately pushed out an RFI. This summer, we had a large, robust response, including EMS agencies that responded and shared what their ideas were. We took those ideas and we incorporated them into our application. We had 6 weeks to co-write our application. It was a very busy period of time, and I just want to thank Tracy for her time. We would give her sections of the application. She would give us her perspectives with her EMS hat on, and we incorporated that feedback into the application. So 6 weeks to write the application. It is a one-time application for 5 years. We will be renewing that application, but it was really important that we got that application really centered on what Alaskans need, because we know that there's going to be, gubernatorial elections, there's going to be presidential elections. We want Alaskan voices to carry this application over the 5 years, because Alaskans, you are there, boots on the ground, delivering the care and meeting the needs of Alaskans. So December 29th, we found out that we are awarded $272 million for year 1. That award amount is going to fluctuate each year, and we can dive into that a little bit later. But again, this is a tremendous opportunity that we have right now. Next slide. So what does transforming Alaska's healthcare system mean when we think through the lens of EMS? And I like to use the house analogy. Our North Star is healthier Alaskans, people who get help when they need it and can stay in community. And I know, you know that EMS is often the first and sometimes the only point of care or source of care in some of our communities. So our North Star is healthier Alaskans. But what is the foundation? So if you look down below at that green bar, it's really paying for better health outcomes. When we have a strong EMS system, we need to, which was a solid foundation, that means that we need to address how we pay for EMS. EMS agencies need stable, predictable funding for their services so that they can keep their doors open. And I'm really excited that we have the resources to really move in this direction. And we'll talk about that in our next slide, of really looking at alternative payment models. So we need to have a strong foundation. But what's in the center of the house? When we look at the system, what the enabling the system means for EMS, it's the workforce, it's the recruitment, the retention, the training, it's the career pathways that EMTs can progress through their certificates into, the licensing. It is making sure that EMTs want to stay in their profession. It also means that EMTs, paramedics, that they have better tools, reliable communication, the data systems are integrated, because we know that you guys are fast-paced, you are moving, and we don't want the data to be slowing down the care that you are providing. And then looking at telehealth and that interconnection between the EMTs and the physicians. Because we know when you are supporting the patients that are in front of you, patients are getting better care. And then finally, what is that other section within the house? And that's, what are the people, what are Alaskans experiencing? And what we want to see, and we do see that right now, is that it's an appropriate response. It's the right care on scene. It's looking at, maybe that person doesn't need to be transported to an emergency department, Maybe they need to be transported to a stabilization center for behavioral health. Maybe it's an alternate destination for primary care. Maybe it's just treating them on scene, but we need to look at that reimbursable model so that EMTs are getting paid for the services that they're providing. It's also looking at from newborns to our elders, from injuries to behavioral health. It's EMS is there across the full lifespan because we know when the system is working, patients again are getting the care at the right time, at the right place. So that is sort of the house. What does that actually mean? We're going to give you some really great examples, but I don't want you to think those are the only examples because I know that across your communities, you all need something different. And the key takeaway that I want you to take from this webinar is that this is a great opportunity. If you have ideas, we want to meet with you so that we can look at how we stabilize, how we expand EMS as it's used in your community or your region. Next slide. So, as I had mentioned before, in the application, there are goals and initiatives. This is truly the heartbeat, the backbone of our application. There are 3 simple goals. The first goal is about the people. It's promoting lifelong health, well-being, in rural, remote, and frontier communities. It's healthy beginnings. It's ensuring that we have, we're supporting our moms in maternal health and our infants, our toddlers, so that they really have those healthy beginnings. It's healthcare access. So wherever you live, you have access to care. And when we say that, it's physical health, mental health, and oral health. And then healthy communities is about that chronic disease prevention. It has components of wellness in the community. It's a broad topic area, but it's really about centered around people. So goal 1 is people. Goal 2 is building sustainable outcomes driven by health systems. So as I mentioned kind of earlier, EMS right now, you are only reimbursed if you transport to the emergency department for insurance. I know that many of you live off of grants, right? But how do we look at our payment structures? And as you as a workforce first on scene, being reimbursed for the care that you are providing, not just through Medicaid, but exploring Medicare and other commercial health insurances. So goal 2 is about that pay for value, that fiscal sustainability, and looking at those alternative payment models. Goal 3 is driving workforce and technology innovation. So it's strengthening your workforce that you currently have, building it out, and it's leveraging technology as a tool to support you and that innovation. I know many of you have ideas on how to use EMS in your region or community that is innovative and different from the standard. This is an opportunity with this federal grant to really explore piloting some of these innovations that you have really been desiring over the years. So those are, again, the 3 different goals. Those buckets that you see underneath, those are 6 initiatives. So if you were to go to the Department of Health website, in the search bar, just type in Rural Health Transformation Program. You'll come to the webpage. You can scroll down. You'll see our application. You can read it. I encourage you to read it. But you'll also see those initiatives have proposed funding uses. And those proposed funding uses, what we wanted to do was what we heard from the RFI this summer and feedback from the EMS Advisory Council. We pulled that together to be broad, to give guardrails with concepts under each of those different initiatives. So to give a vision of what it looks like, but not to be restrictive. So if you go to our website, you pull up the proposed funding uses, and you're like, I'm not sure I see EMS in there. EMS is woven throughout, but we're not calling EMS out specifically. We may just say healthy beginnings, and you have to apply EMS to healthy beginnings as an example. But we're going to dive into that in future slides, so you can actually kind of drill down what each of those initiatives could look like for EMS. Next slide. So I will pass it over to Dr. Bob Lawrence.
Yes, thank you, Commissioner. Good morning. It's good to see everyone. My name is Dr. Bob Lawrence. I serve as the Chief Medical Officer for the Department of Health. It's so good to see each of you. And what I'd like to do now is, first of all, recognize that I bet most of you have an idea or some idea of how the EMS system in Alaska can be made better, particularly for your region. What I'd like to do is to take that idea and encourage you to make that idea bigger, and then also see how that idea fits into the overall structure of how EMS is growing throughout all of Alaska. I am a family practice physician by training. I started my career out in Northwest Alaska, working for the first 10 years in frontier regions, standing side by side with many of you in the emergency department, or running our medevac flights, flying through windows in weather to land in very small communities and transport people into the Anchorage region. I was able to stay for periods of time, weeks on end, in some of our small communities like Shaktoolik or Unalakleet. And so I understand what that's like to live in those really small areas and then to stand side by side with you, taking care of both minor medical emergencies, doing house calls, and standing side by side with our EMS professionals on in the clinic, taking care of major emergencies too, whether those are airplane accidents or boating accidents or dog sled accidents or bear attacks or gunshot wounds. I mean, all the things that occur in the frontier where weather and timing and distance and all of this has to come into play in terms of making sure that we're prepared to take care of people. But what I learned in all of that is that EMS is not just one component of what we do. It's certainly not just a 911 call with lights and sirens response. EMS is an entire system that begins at a point of crisis and does not end until all the way through the system we end up back at a point of restoration. And so part of the RHT opportunity that we have is to build out different parts of that system, whether it's on the front end, when a crisis call comes in, building out the system to know who's going to respond to that call. Does the response need to be a paramedic? Does it need to be a mental health professional? Does it need to be someone with medical experience and mobile integrated health type of program? And what do those individuals need in order to provide care for that particular crisis? Can the treatment be provided in place? Or does the person need to be transported to another location? And does that other location need to be an emergency department? Or could it be an alternate location for addressing the person's particular needs? And then once a person arrives at the facility of treatment, what role does the EMS professional play in working in that clinic or that hospital setting? And then when a patient is transferred from one hospital to another, what role does EMS play in providing professional transport between facilities? And then on the other end of all of that treatment and rehab, what role does EMS play in each of our regions in helping to make sure that a person returns to their community and is appropriately transferred back into the point of restoration, perhaps their home? And what role does EMS play in making sure that wellness visits occur, that a site evaluation has been done to make sure that the restoration is in a place of safety and that that whole cycle doesn't have to repeat itself for that particular individual? My point in all that is to say that is the whole EMS system. And the question is, in your region, which part of that system are you best positioned to take and then build out? And to help us to think through how we can use this funding opportunity to really build out our EMS system, I'm going to turn it over to Tracy Loskar to help us to think big about potential ways that this program can support our build out of the EMS system. So Tracy, may I turn it over to you?
Next slide. Thanks, Dr. Lawrence. Excuse me. I appreciate the opportunity. You know, I think Alaskan EMS, just being here in Alaska, I mean, we're uniquely poised here with this funding opportunity because our system here is unlike anywhere else in the country. And with the diversity of the state, we've developed this ad hoc compilation of services that grew out of available resources just from the necessity of survive. And I think more than any other state, Alaska proves that EMS is healthcare infrastructure. And in many communities, it is the only access point for emergent care and is the entry point for the healthcare system. And what that does and why it makes us ideally suited for the RHTP is, is it puts us in a unique position to demonstrate potential as a national model, because whatever we can make work here will work anywhere. It also means that we also have stakeholder alignment, right? So whether we're talking EMS departments or hospitals or mental health trusts or tribal partners, they're all identifying similar needs. So what that means is we're an integral part of the healthcare continuum. I mean, you just demonstrated it with the previous slide. So again, when you're sitting and looking at your projects in ask the next question and think bigger and how we turn this into not just a corrective grant or addressing a smaller problem. How do we turn this into system reform? And I am not the only voice here. I am not just the only representative when they talk about the RFI. In addition to my role in Mat-Su, I'm also serving as the chair for the EMS Advisory Council, which was the brainchild for the former section chief of the Alaska State Office of Rural Health, Gene Wiseman, who it's a group made up of leaders and frontline perspectives from across the state. It's a new group of rural and urban services, tribal health, air, transport, fire, hospitals, training, trauma. They're meeting regularly, and they all had a preliminary say in the RFI. So it's not just me. And we're going to be reaching out in the coming weeks and months to agencies throughout the state, so you'll know who your current contact is and how to reach them. We'll do that working in conjunction with Tricia Franklin. Let's go to the next slide. I think it's everyone recognizes that EMS is critically important. It's evolved over the last 50 years, but exponentially more so in the last 5 years, especially with the advent of mobile integrated health or community paramedicine. But when you use a term like mobile integrated health, it's this umbrella term that encompasses so many things about bringing EMS into the home and into the community that it's hard to give it one particular focus. The RHTP gives us the opportunity to build out these opportunities across the state and fill in a bunch of gaps that meet unique needs for each community and meet them where they're at instead of a one-size-fits-all model. That doesn't mean that the RHTP is just for things like MIH. It's just to give you an idea and one direction to consider, that alternate transport, treat in place. Does everything need to be transported? Where else can you aim your agency at? It's a historic opportunity. If we want to have lasting change, then we need to adjust our thinking and move away from a reactive mindset towards one that thinks a little further ahead and is prepared to respond to things in the future. So if we look at the pillars here, if we look at the slide, which reflect the initiatives, they reflect everything that impacts an agency's immediate needs. So later on, when Tricia tells you how to work through your letter of intent, when you go to decide what your needs are, what you want to work on, where does it fit for you? Is it a project that works to improve your clinical care? Is it improving your reimbursement and long-term funding so that you can stay afloat? Does it work for your recruitment and retention and strengthening your infrastructure so that you can reach the people that you need it the most? This is not just about buying a piece of equipment, right, that you've been struggling to for the last few years, but looking ahead to what the needs of your department and community are, and then to your system, which ultimately benefit your community and then the state. I think when it comes to system reform, it can be so overwhelming to think about these huge changes. You're not alone in this. You have partner agencies. and working together with them. What are their needs? This is not just about getting a grant. This is about system change. It's terrifying and it's exciting at the same time. Let's go to the next slide. Because what does that mean? That's a lot of concepts, right? So what does that look like? If we were to make a shopping list, if we were to walk into our local grocery store and say, I was just given a very big check, what do I do with this? And how do I make it conceptually fit system design and help my community? Well, this system change. Here's some examples. So if you're a smaller agency, this is what it looks like. I mean, here in our house here, we have a saying about ask the next question. If you don't know what the next question is, come to me and I'll immediately ask you what the next question is. One example would be point of care ultrasound. It's a hot topic. Everybody wants to do it, but it's not just about buying the piece of equipment. What would you need to do to institute point of care ultrasound, right? You would need time to research the models. Well, that time has worth, right? You would need funding for the purchase of the models. You would need infrastructure and funding for training and implementation. And then once that's in place, what's the goal? What are you using it for? And this is where there's a difference between getting it for your agency and getting it for the system. Are you using it just for pre-hospital use? Is it just for destination choice? Or could you look to your partner agencies and find additional uses as well? And how would that affect your reimbursement, improve the care within your community, and perhaps increase your revenue to help you stay afloat in future? Who could you partner with in advance to do this that you could benefit from? That's the difference between getting a grant and system change. We could get point of care ultrasound to help us do a fast exam for a trauma patient, or we could co-locate or partner with a local urgent care or a clinic and look at the possible possibilities of doing in-home exams for patients who maybe could not get into town or could not get into a larger location. And that's me just thinking on the fly here. The same thing goes for recruitment. You could put in to fund an EMT program, or you could sit and say, maybe we build a career ladder that goes from EMT to paramedic to community paramedic program with a funded intern and externship program with perhaps a hub and spoke where providers rotate within the state to increase their experience and skill, which is a big problem in a lot of areas in the state. Or they integrate directly with the CHAP program, co-locating with clinics and expand their services, and then revisit what they're getting reimbursed for to provide additional services to the off-road communities. Or go completely outside of the box and say, what could we do for role expansion, right? Could we do things with mid-level providers and telemedicine that we're not doing right now for well baby, OB exams, forensic exams in areas of the state where there aren't SART or SANE, for places where we don't have sexual assault nurses immediate available. It's not just about buying an ambulance. It's about buying an ambulance that's set up in the back with audiovisual that's prepared and wired for telehealth with satellite broadband that can then contact the mid-level provider at the alternate destination that's already approved for reimbursement that won't strain the community or the agency. That's sustainable long-term change. And I know we keep saying things like alternate destination, right? Which in Alaska, I don't have a lot of alternate destinations. And that's, again, where you have to go out into the community and partner with Commissioner Hedberg and say, what does an alternate destination look like? And how do we work with CMS to say, what do these payment models look like? How can I work with a rehab center? How can I work with an urgent care? How can I work to get funding, for seasonal transports? And during high season, where can I take these patients? How do I get funding for treat in place? for low-level patients. That's what we're talking about when we talk about alternate destinations or treat in place to reduce the strain on our local communities. But that's what we're talking about when it comes to sustainability. It's not just about fixing what's broken right now. It's about looking where we're at, because we've evolved tremendously in the last 5 years, and so has our need, and so has our demographic, but so has our capacity. And saying where are the gaps and what can we use this funding for to fill in those gaps and bring us forward as a diverse model, because what Western Alaska needs is different than what I need, is different than what Southeast needs, and bring us forward into the next 20, 30 years. And with that, I will turn it over to Tricia to tell you how to do this.
Thank you so much, Tracy. I'm Tricia Franklin. I'm going to give you a quick overview of the grant application guidance. And we're going to make this quick because I see your questions in the question and answer, and we want to try to do as many of those live as we can. So with Rural Health Transformation Funding, it is CMS, or the Centers for Medicare and Medicaid Services funding. And so there's boundaries around that. And so just reviewing the things that are not allowed. Construction is not allowed. New facilities or building expansions. No land, no buildings. We can't use this money to fund clinical services that are already covered by insurance, and we can't use it to supplant existing funding. This is short-term funding. We need a way to think about how we're going to continue to pay for things, and we aren't just inserting it and then falling off the cliff later. Broadband infrastructure is not allowed, internet installation costs and telecommunications equipment. We do have questions in to CMS about Starlink, and so hold on that one. We're not quite sure yet. Provider loan repayments are not allowed. Direct payments to individuals, that would be cash assistance or gift cards. Supplanting state contributions to the Medicaid match. So some of our funding sources require a non-federal match. We cannot use that for this, and we cannot use it for food. So more details on this type of information are found in FAQs on our website, on the Rural Health Transformation website, if you really want more information. So next slide, please. So really high level on the funding pathways, I want to give you a perspective. There are 4 different pathways. So the first pathway, we want to make sure that you're administratively ready. So and provide resources to help you get there if you're not. And so that's a simple letter of intent and a way to figure out what are your needs. The second is planning. Maybe you have an idea but need support to pull that together and create a plan that will be implementation ready. So that's the second pathway. The third one is project implementation. And we think of that as you're ready to go. You've got everything you need. You just tell me where to sign up. That's your pathway, and you'll get guided through that. And then the fourth is targeted innovation projects. This is very much under development, so we're not going to spend a whole lot of time there. So there are more ways to get information on this application process coming up in the next webinar, which is on February 10th, which, next slide, please. Here's all the information you will need. There's the QR code to register for that application webinar. There's the link to the email for information, and there is our website. So I will turn it back over to you, Commissioner Hedberg.
Thank you, Trish. I appreciate it. And thank you, Tracy. And thank you, Dr. Lawrence, for just sharing how RHTP can be used to support the EMS system. Like, you guys, this is such a great opportunity. But I am sure there's a little bit of head scratching, like, is this going to be approved, or this is going to approve? So I really encourage all of you, please take a moment, scan the QR code, please register for the next webinar, and we're going to walk you through how to register and what are the questions that we're going to be asking in the letter of intent and when the portal is going to open. And then again, reiterating, on our website, we update the frequently asked questions. So if you're not sure or you can't remember, please check there first. We do try to cultivate and generalize what we hear from Alaskans, take that, synthesize that down into questions and provide the answers. But remember, this is a cooperative agreement. So we are staffing up. Trish, welcome to the Rural Health team. And CMS, the Centers for Medicare and Medicaid Services, they are administering this federal grant. They are also staffing up as well. So collectively, across the United States, we are all staffing up so that we really can work together, partner together to appropriately administer these funds. Real quickly on convenings, you're going to hear the word convening. It's really a spot for us to gather. We will be hosting future convenings on the RHTP program. It's a deep dive into any of the goals, in addition to an annual convening that really pulls us all together to reflect in year one, what have we accomplished, what is working, what are next steps. So with that, I see questions are being entered into the Q&A. Lindsay, I will pass it over to you to start going through the Q&A.
Thank you, Commissioner Hedberg, and thank you to all of our speakers today. I always learn something new when I hear from all of you. We do have some questions in the chat or in the questions and answers, and if you have additional questions that you're thinking of, now is your time to ask them. I do want to say that the PowerPoint slides will be available as well as the recording on our website, so we will make sure it'll be that website there at the top, the health.alaska.gov/RHTP. The first question that I have here was earlier on in the session, is emergency services included in this program?
It depends on how you define emergency services. So Scott, you can definitely re-ask the question, but yes, emergency medical services. So EMTs, paramedics, very much a part of the healthcare system. As you heard Tracy say, community paramedicine, mobile integrated health teams, that is all encompassing and very appropriate for this RHTP opportunity. If you're thinking time-sensitive events, you know, like heart attacks, strokes, sepsis, trauma, yes, time-sensitive events is very much interwoven into healthcare, and we need to make sure that we live off of a hub and spoke system. That hub and spoke system is supporting those time-sensitive events. Hopefully that answered your question.
Thank you, Commissioner. This is more of a comment, but I also wanted to pose it. Just Tracy, Trisha, Commissioner, and Dr. Lawrence, if you have any ideas. The comment is, we keep talking about alternative destinations, with which I agree. But what if all you have is an emergency trauma technician or a community health aide and no other community resource? We're not an integral part of the continuum, but we really need to be. Any comments there?
I think we will all contribute to this answer, but that's the heart behind the focus of this RHTP program. You have an ETT, but they need to be connected in to the hub. And so if it doesn't exist, we need to build that out. So, and whether that is a tribal health organization, whether that is setting up a connection with a clinic, a federally qualified health center, or a hospital, like we need to make sure that our communities are connected into the healthcare system. Again, physical health, behavioral health, and oral health. That can be virtual, it can be in person. But if you don't have a physical footprint in your community because your community is so small, you still have a role and you can use this funding to build it out. I would encourage you to reach out to Trish and she can set up some technical assistance to walk through how to support your community.
Thank you, Commissioner. I think this one will go to Tracy. It was while you were speaking. This individual is interested in clinic co-location. Did you say TAPS program, TAPS program when you were speaking?
I don't think that I did, so I'm not sure if he's talking about the transition assistant program or not. I was talking about just working with your local clinic uh, for co-location of services, you know, for expansion of care. But no, I wasn't referring specifically to co-location. There are multiple comments in the Q&A box about the QR code being deactivated. If somebody could look at that, so we could.
We have been responding there
Okay.
with the link that is working. Sorry
Okay.
about that.
Okay.
Thank you, Tracy. William, if that didn't answer your question or that wasn't the program that you were speaking of, feel free to put something else in the Q&A chat and we can make sure that we address that. The next question is direct payment quote. Would providing tuition assistance scholarships for workforce development be considered direct payment?
So that's a great question. I'm happy to take that one. There's a line in there when you read some of the FAQs. If it helps someone on their career path to advance to like a next level, it's considered a 5-year service commitment. They need to make a 5-year service commitment. If it's just continuing education, they don't need to think of it that way. And so direct payment, I think a better way to do it might be to fund a program and make the fees for the program very small, or design some other a way to do it. This is one area we need to check in with CMS. Obviously, I'm kind of scrambling on it. Thanks.
I would just say real quickly, big picture. If you want to use funding for incentives for your workforce, there's a caveat that that person needs to commit to 5 years of working in that community. So please be cognizant of that. But while you can't reimburse for student loans, tuition is appropriate, incentives for recruitment is appropriate, but there's a commitment for 5 years, and that's a really important distinction that you should care for.
Thank you, Commissioner and Tricia. The next question is, what about generators for alternative care facilities?
Great question, Erin. What I would say is, does it meet the goals, right? Is it transforming care? It could be, it depends on how you respond to the letter of intent. This funding is not about paying for what you would find in operations. And there's a fine line, it can get a little blurry. So if you don't have any other place to take care of your clients or patients in your community, and this is a critical need, it could absolutely fit into that. But I think we would have to know more information to determine whether it's a yes or a no. I would also tell you that everything that the decisions made by these applications, everything flows through CMS. So CMS is going to have eyes to say, does that meet the original intent of RH2P, which is transforming care in Alaska?
Thank you. I personally love this question because I know it came up a lot in our in-person convening. But does Department of Health plan to expand community health worker CHW programs in rural Alaska? And how would you envision EMS and CHW integrations potentially playing out?
Angela, I love your question. The answer is yes. We are very excited to use this funding to build out the certification process for community health workers, have it be reimbursed by Medicaid. This is a new workforce in Alaska that needs to partner with all the different disciplines in the healthcare system.
Thank you. The next question for these the steps that we have to go through.
Lindsay, you broke up, but I think the question was, can we do planning for 3 to 4 months and then move into implementation? So if you remember Trisha's 4 pathways, administrative readiness and planning are going to be on a shorter time frame so we can get the money out the door quickly. Project implementation means you have a plan and then you're ready to move into that project implementation. Right now for year 1, right, we have 1 opportunity to apply for that project implementation, but year 2 is right around the corner. So don't fret, like there's going to be more opportunities for you to apply for that project implementation once you have your plan.
Great. And just a note, our communications team is working on the QR code. So if you were trying to get in there and you couldn't, we will make sure, hopefully by the end of this session, but if we don't get it figured out by the end of the session, I think we have everybody's email address based on your registration, and we can make sure that you get the link to register for February 10th. From Matthew, I didn't see vehicles on the off limits list for funding uses. Do you, or when might you, have clear guidance on whether ambulances or mobile response vehicles will be allowable?
So what I would say is to apply with a letter of intent on what your need is. We're going to send that to CMS and they're going to review and see if it meets the goals and the initiatives of the Alaska application. It's a very common question we get, but you need to demonstrate how that is going to transform care in your community.
Is there an approval process for vendors in order to be considered by agencies in Alaska?
So this funding is for Alaskan-based communities. So if you are a vendor that's from the lower 48 participating in this webinar, you need to reach out to the EMS agencies in Alaska and build a relationship with them.
Yeah. Is there access to the EMS Advisory Council meeting minutes and ability to observe future meetings?
I can take that. Those meetings are publicly noticed. Note that it is a relatively new committee. I think we have about 3 meetings, quarterly meetings under our belt. So be patient. Those meeting minutes are going to be available on a website soon, and watch for public notice if you would like to participate.
Yeah, I think there's only 1 set of minutes from October available right now, and the next meeting is April 16th at 1:30, and there'll be a Zoom link available on the State of Alaska online public notices probably 4 weeks before that date.
Thank you both. I know the commissioner has to leave just a few minutes early, so I'm just scrolling through questions to see if there any that are specific to you, Commissioner Hedberg. Is there, I'm going to go over down to Douglas. To integrate state resources for for RHTP, is there a way to collaborate with like services so there are not many siloed projects that could benefit from a cohesive solution?
I love that question, and the answer is yes. So I'm giving you a little sneak preview. We're building into the letter of intent, which is truly a form fillable on your computer. You're going to enter the information in there. We're going to ask you the question whether you want to be matched with another organization that's doing a similar project, so that we can bring people together that are working on the same thing, and you can work together and evaluate whether you want to submit an application together. In addition, that 4th, yet exactly. So when you see targeted innovation projects, for the Department of Health, we have a statewide perspective, and we want to make sure that we're meeting the needs across the state. So when we start to see commonality in an application, or with letters of intent, excuse me, we're going to say, look, here is the problem, and we're going to identify resources to address that problem. So think of it as a prepackaged, here's an opportunity for you to join in and participate in whatever that project is going to be. It is going to help from the smallest EMS volunteer agency that wants to participate in something big, but doesn't have the infrastructure to do all of the work to find the resources to do the project, to equalize it with the larger organizations that have those grant writers that can, execute those grant applications. So those prepackaged targeted innovations is forthcoming, but we're going to see from the letters of intent if there really is some commonality within EMS. So hopefully that answered your question.
Thank you, Commissioner. I think I'm personally interested in your response to this one, which is, hold on, I just had it. The state already pays for, I'm kind of paraphrasing here. The state already has public health nurses. How do you see potentially public health nurses playing a role in where does the public health nursing system fall into this? The state already funds these positions, which would be better positioned to provide some of these expanded services. Do you have any comments to that, Commissioner Hedberg?
Well, Lindsay, you're the director, so I would also defer to you. But our public health centers play a key role in our communities. And yes, absolutely, they're the conveners to bring people together. Specifically to our nurses, they're trained with infectious disease and pulling partners together to identify what is the problem, what's the solution, how do we move forward. So yes, I think they're an integral part in this process at the community level.
Thank you, Commissioner. Is reimbursement for AD-TIP one of the goals for all patients or patients covered by CMS alone?
Treat in Place, I believe, is the acronym. And so there's two policies that that was raised to our attention. One is to treat in place and transport to an alternate destination, and to be reimbursed for those two types of services. And I think that's something that we want to work with you, the EMS community, to pilot, to build out, to see if it works. And if it's working, to build in that sustainable funding system, which means it's reimbursable, whether it's Medicare, Medicaid, or commercial insurance. And I think I've seen a theme on transport to an alternate destination. Think about in your community as an EMS provider, are you close to a federally qualified health center? Do you have a clinic, right? We have communities that are standing up behavioral health stabilization centers, right? So and that is something that is the next evolution of EMS. Again, remembering we want to make sure that that patient has the right care with the right resource at the right time. The emergency department is really intended for those time-sensitive events, and they're overcrowded and overwhelmed. How do we decompress that? By building out these other systems.
I'm trying to pay close attention to the time because there's so many great questions here in the chat. I think while we have you, Commissioner, given the department's 3 rural health initiative goals, are you prioritizing any of the 3 for the next funding cycles? And what proposal structures or outcome metrics would make a submission most competitive?
That is a great question. First, I really encourage you, take the time and read our application. It's 60 pages. It's easy reading. And in there, you will see our metrics, and which are big, right? There's some that are far-reaching. There's some low-hanging. We wanted to challenge ourselves, okay? You will also see the milestones. And if I remember, it's on like page 40 or 41. You'll see the milestones and what we've committed to. Now we're updating some of those milestones right now because we were a little excited when we wrote the application. I see you smiling, Trish. But that is sort of what we're starting with in year one. What was the second part to that? That was the other part, Lindsay. We want to make sure that everyone has access to this information. So we are recording these webinars, we're posting the webinar. Next Tuesday, we are going to have another webinar that talks about how to register and the letter of intent. We want to walk everyone through the process so that everyone has that equal opportunity and understands what we are looking for. So the best thing that you can do is to educate yourself on the application and really focusing in on those goals and the initiatives and those proposed funding uses. You guys, thank you so much. This was great. I'm very passionate about EMS. I'm really excited about this opportunity. I do need to leave, but I'm passing it to very capable staff, Tracy, Trish, Dr. Lawrence, Lindsay, and you guys can continue to answer those questions. Take care, everyone. Bye-bye.
Thank you, Commissioner. All right, we've got about 4 minutes left, and we have quite a few questions still in here. I want to, I'll be a little selective if I feel like the commissioner maybe already answered some of these. This question is, the state of Alaska willing to work on more billing codes for us to bill out for alternative sites?
I can give that one a try. That's the idea with sustainable funding, is to start to think about what are the pathways we can use to make that happen. Do we become providers or extenders under CMS? Do we add coding and billable codes through a waiver or some other mechanism? But that's the idea.
Thank you, Tricia. I think going back to the community health workers, if community health workers would be a new funded workforce, could existing unfunded EMS workers also have a community health worker role in order to strengthen the existing emergency response system and provide the community health worker role where appropriate? I don't know if you all have any thoughts on that.
Quite possibly, I'll jump in there, Director Cato, and just say thank you, first of all, for that question and the heart behind the question. But I think it also highlights an opportunity to answer a question that applies kind of across the state. And that is, the answer to the question is most likely or possibly will be yet to see in terms of how we'll be able to fund the community health worker role. But that's the right way to be thinking. And that is to say our EMS system overall is not hyper-focused on one particular role type, but this opportunity that we have gives us a reason to really think about who lives in our communities, who can be a part and invited into the EMS process, who in our communities currently are working as volunteers. And there could be a way to actually fund the work that they do in the EMS space. It gives us an opportunity for different agencies in communities that normally are working in parallel but quite separate. It gives them the opportunity in those communities to actually talk to each other and say, how can we, as Tracy said earlier, partner and work close together, each working on one side of the equation. And so that's where I put the community health worker question. It's kind of in that broader idea, which I think is a great one, of looking at how can we build out a resource that's already in our communities.
Thank you, Dr. Lawrence. I am putting on this last slide. I don't think the QR is working yet, but we will make sure that everybody gets the link. It should also be in some of the answered questions if you didn't see that come through, but I think we have access to all of your emails from your registration. I wanted to highlight here the RHTP at alaska.gov. There are a few questions that we weren't able to get to today that are great. I want to encourage you all to contact the team through that email. Trisha, I think that's where we would direct questions instead of directly to your inbox since your role is changing. Okay. Wonderful. And I just want to thank you all. I think we had a close to 150 attendees today. Thank you so much for making time in the middle of your busy Thursdays. We look forward to seeing you on February 10th. And please don't hesitate to reach out with additional questions, concerns. We want to hear from you. Thank you all and have a great day.